Everyone, welcome to our webinar for our Microcredential for health professions, designing educational resources coming out of the instructional design program at Quinnipiac University. We're really excited to have all of you join us here. I know most of you have taken IDN coursework, so you have a basic understanding of instructional design, and we're really excited to have Professor Barbara Nadeau, occupational therapist who is a faculty at Quinnipiac, give us a presentation tonight, making those connections really explicit about how we can apply instructional design to healthcare settings. So thank you all for joining us, and I'm going to turn things over to Barbara.
Wonderful. Thank you, Kristen. So I had to make everything smaller. So if you will have a question, something to share, just unmute and talk because I'm not going to be able to see you because I need to be able to see my whole screen here. So feel free to ask questions at any point. So as Kristen said, my name is Barbara Nadeau. Work here at Quinnipiac. I'm the chair for occupational therapy, and I've been an occupational therapist for many years. And I'm also really interested in instructional design. And I went through a certificate program recently with Quinnipiac's instructional design program. And so when Kristen reached out looking for somebody to talk about instructional design and healthcare, I was like, oh, that's exactly the things I love. So I jumped at the opportunity, and I'm happy to share some ideas with you guys tonight. So tonight we're going to talk about how to apply instructional design to the healthcare environment. So things that you've learned in your microcredential program or things that you're going to learn if you haven't quite done it yet. This will be a preview for you of some of the concepts that you'll learn in that program and how you might apply it in healthcare. We're going to talk about the unique challenges of providing education in the healthcare environment, and then how, when we use instructional design principles, that can help us increase the efficiency and effectiveness of our trainings. And then we're going to work together to design a training, or at least some components of a training. And I'm going to give you a little magic wand, and we'll get more on that in a little bit. So those of you that have already taken the microcredential, you'll know that one of the first things you need to do in instructional design is come up with your learning objectives, and those guide everything that you do. And so I spent a lot of time thinking about my learning objectives when I was developing this, because I was kind of torn. I was trying to decide if I was going to focus solely on educating healthcare professionals or if I'd also include patient education. And I really wanted to do both because I'm really interested in the idea of applying instructional design principles to patient education. But one of the first things we need to do in instructional design is analyze our task. And so I realized my task was a 1 hour-ish webinar. And I also know my area of strength and content. And I had checked in with some of you. And so I knew that some of you were interested in doing training to your colleagues. And so given all of that, I decided to make the decision just to stick with focusing on educating professionals. I am still really interested, though, in how instructional design might enhance patient education. So if any of you are interested in that, I would be really interested in doing some kind of activity or training or research or something related to that, because I think it is an underutilized area for instructional design. But with that said, my learning objectives for tonight are that at the end of this webinar, you will be able to describe the unique challenges and opportunities for using instructional design in healthcare, design interactive activities to support learning, describe some time-saving techniques for creating trainings, because that's one of the biggest challenges, I think, and then develop a plan that utilizes instructional design principles for educating colleagues, so that when you leave here tonight, you'll kind of have an idea about how to apply all this to your own setting and what you want to do. So we're going to be using a few different Slido slides throughout. And I don't know if any of you have used Slido or have had interactions with that before, but it's kind of like Poll Everywhere, those other polling things. And so for this, you can access this Slido by either using the QR code, or you can go to slido.com and join it using this access code 2230-024. And so I want you to join one way or the other and go into this and answer this prompt. How is educating in the healthcare environment different than in a higher ed classroom? So, right now you've been doing this course, it's an online classroom, but it's a higher ed classroom. How is educating in the healthcare environment different than that? So go ahead and answer that question. It's anonymous, so don't worry about what you say. And then we will see what people said. So take a few minutes to access the poll and give me your thoughts about that. Okay, and this is the part where I pray that the technology actually works. I'm going to click and hopefully we're going to see your responses. Here we go. Okay, so this is showing up as a word cloud, and so I can see all the different things that you guys said. So in the healthcare environment, there's more hands-on learning. We have adult learners, it's higher stakes, variable baseline knowledge, people are highly intelligent. And there might be some of these, the word cloud didn't work exactly right. So I'm not exactly sure how some of these fit together, but there is a focus on policy and procedure and things like that. So I agree with all those. And I also came up with a little list, which very much dovetails what you guys said. So we have audience needs. In the healthcare environment, they want things that are immediately applicable. There's not time for a lot of theory and abstract ideas. We want to learn something and we want to be able to apply it. There's a real focus on competency and mastery of practical skills, and perhaps even demonstrating that competency as part of the training. We have to always think about patient safety and ethical considerations at a different level than we do in a higher ed classroom. And when we're sharing information or talking about cases, really keeping that the HIPAA compliance and just thinking about what we do and how that might impact patients. In a healthcare setting, it tends to be more interdisciplinary. So we'll have audience members from every discipline, ideally in our classroom, versus often in higher ed, it's constrained to one or maybe two disciplines. Like when I teach in my classroom, it's all OT students. And so that limits some of the things that you can do. And it also, in some ways, makes it easier because everybody is learning the same content. In healthcare environment, people are going to come with different baseline knowledge, with different interests. And so we have to take that into account as trainers in that environment. And then there's time constraints. There's time constraints for us as people providing education. So, this is often something we do like an extra. And so trying to fit it in can be difficult. And then for our participants, they also have time constraints. There's just limited time for training. We're in these environments to provide care to patients. And so training is often something extra. So as trainers, we have to consider, what's the most efficient way to provide that training? Do we need to do something online? Does it need to be on demand? How can we structure our training so that it can meet the needs of our learners? So sometimes, I know in the past, when I was doing trainings earlier in my career, I would just kind of throw something together. I want to talk about this. And then after I thought about what I talked about, I would think about which objectives match that. I really didn't go about it the right way. I didn't use the principles of instructional design. But we know that when we use the principles of instructional design, things are going to be much better. So our learners are going to learn better and faster. So we'll improve their efficiency. They're more likely to remember what it is we're teaching because we're doing it in a thoughtful, structured way. We're develop skills and demonstrate competency better. Ultimately, that will result in increased patient safety and reduced errors. It's more cost effective. It's more cost effective for the trainer because, again, I can create trainings more efficiently and more effectively. It's more cost effective for the organization because what I'm teaching is going to be taught in a way that my participants can take that knowledge and use it. And then there'll be compliance with regulatory standards because I'll be aware of those. All right, so I have another Slido for you. So one useful way to learn is from mistakes, but it's much more fun to learn from the mistakes of others than our own. So I'm going to ask you to answer this question. Provide an example of an experience where you've had a bad workplace training. And in this case, we'll say that, HIPAA kind of rules are in effect. So don't provide any identifiable information about the trainer or what, exactly the training, but just describe what the presenter did wrong. Okay, so I'm seeing some themes here, and it's really about the idea of engagement and interaction. And when people don't provide any interaction or don't do things that are engaging, it can be really boring and dry and hard to remember. Also, when people are talked down to, that can be really uncomfortable as well. So these are great examples and definitely things that we will avoid, and hopefully I'm going to avoid tonight as well. I want to talk a little bit about how you might use interactive activities for learning. And there's a few different ways. Luckily, healthcare really lends itself to using interactive activities. And as an occupational therapist, I'm really a big believer that people learn through doing. And so the more you can have your attendees do during your training, the more likely that they'll remember something from it. And these are examples of some interactive activities you might use. So you probably are all familiar with Think, Pair, Share. The idea is I would give some kind of prompt. I would have people reflect on that prompt and then get together in groups of 2 or 3 and share their ideas or their responses to the prompt. Case-based learning, we're going to look at in just a little bit. And that really fits well with healthcare as well, because we have cases to talk about. But cases don't always have to be like a patient case. They can be a case of a situation. And so I guess what I'm going to have to be doing later is kind of a case of a situation. We'll get to that. It's not exactly a patient case. Role playing, we're going to talk more about that in a second too. But role playing can be a really effective way to learn skills, but there's some drawbacks to it. Interactive polls and quizzes like I'm using tonight that you guys have done a couple of already. For that, I'm using something called Slido, and that is an app you can put directly into PowerPoint, and then it's just there on the side of your screen. You can build the slides right into your PowerPoint. It's so easy to use as a presenter, and I'm hoping that you're finding as an audience member, it's easy to use as well. The free version allows you to have a limited number of participants and a limited number of interactive activities per PowerPoint. You can get a paid version, which I think is about $80 a year, and then you can use it as much as you want, as many slides as you want, as many participants. I mean, I think there's a limit, but it's probably a limit we wouldn't go over. And so it's a really nice, easy way to add interaction. Problem solving in interprofessional groups is also really a benefit of doing trainings in the healthcare environment. Typically, as we were saying before, our audiences are interprofessional. The one thing to keep in mind if you want to do that is that, at least in my work setting, people go to trainings and all the OTs sit together and all the PTs sit together. So we're not in interprofessional groups. We're sitting with the people we always work with. So if you want to do problem solving in interprofessional groups, then you just need to think about how you're going to structure that so that people sit where you want them to sit, so they are interprofessional. But it really is a nice way to do things and allow people to meet other folks that maybe they don't normally interact with. And then simulation training. Simulation training is a little bit more complex, but it's a great way to practice skills, to demonstrate proficiency of skills. And there are some settings where people actually have access to mannequins and simulation suites and things like that. So if you have that, that's a wonderful addition to training. But there's reasons that people don't use interactive activities in their trainings. I want to talk about two of them. And this first one kind of resonates with me. Participants might say they don't want them. So I think one of the things that drew me to teaching in the first place is that I'm a really lazy learner. Like personally, I would prefer to have someone just tell me stuff and not have to engage at all. Like just spoon feed it to me. However, I know from my own experience that when I go to a presentation, the things that will stick with me are the parts where I actually had to interact with others and actually do something. So I know I learn best from that, even though I am a lazy learner. So I take great joy in designing learning experiences that draw in other lazy learners and provide them with that deeper level of learning. But I also know as a lazy learner that if you put something in the course description that says, oh, today we're going to learn about X and then we're going to do role plays, I'm going to be like, yeah, no, I don't want to do a role play. That's scary and hard, and I'm not coming. But if you were to put something in the description that said, we're going to do interactive activities, we're going to have hands-on learning, well, that's a little less scary and a little bit more appealing and a little bit more likely that someone like me would come to something like that. So it's a good idea to have interactive activities and putting that in your course description or your flyer or however you're advertising your training is a good idea, but just be careful about the wording that you use so that you don't scare people away. When you're going to be doing activities that are interactive, there also is a kind of a level of risk associated with that, particularly for people that are maybe a little bit shyer or more introverted. And so when you want to do something where you're asking people to do something that's high risk, like simulation trainings or role playing, you want to work up to that. And you can do that right within your training. Like it doesn't have to be over a matter of weeks. It can happen within the training itself. But starting out with, a lower risk activity, you wouldn't want to come in and have people do role play right away, unless people really knew each other well beforehand. So in general, you want to start with a lower risk activity that allows people to become comfortable with each other, to bond with each other. And so things like interactive polls, that's a really low risk activity. The nice thing about it is you could see on the screen, oh, look, at a lot of people think just like I do. And so I begin to feel like I fit in. Doing think, pair, share is a really nice activity to begin with. Especially the first time you do one of those, it's nice to have people introduce themselves to each other. And now they know somebody in the room, they've had a little conversation with somebody. Again, they're beginning to feel more comfortable, like they have a little bond with people. And then you can work up to doing things that are a little bit moderate risk, things that maybe have a right or wrong answer, where there's more discussion or more opinions. So things like case-based learning or interprofessional problem solving, and then those higher risk activities such as simulation training or role play. And with role play, generally there's somebody in the room that actually loves this stuff, well, is an actor, just loves being on stage. And those people might volunteer to come up and do something in the front of the room. And that's great. If you have people volunteering to do that, fantastic. I wouldn't call on people and make them role play. But if you want everybody to participate in a role play experience, because you want everyone to learn that skill, then having people in small groups where they're just paired off, they're doing it privately. Maybe there's one observer giving them feedback, but trying to create a safe space for people to learn skills. The other reason that people sometimes don't use interactive activities is that people believe that there's not enough time. And sometimes there's not enough time because people put in too much content. You know, as healthcare professionals, we know a lot of stuff. And when we go to teach it to others, we sometimes feel like we need to teach them everything we know, they need to know everything about this topic in order to be effective. But actually that decreases the effectiveness of the training, the more you put in it. So it's better to, weed it down to the essence of what you want people to know. And that's ultimately going to be a more effective training. I went to something recently where they were talking about in higher ed, and I think this can happen in training in general, this thing called content hoarding. I thought that was a great name. And basically the idea is that, we create content, a course, a training, and it's good. And then we go somewhere and we learn more. And so we bring that back and we put that in the training too, or in the course too. And then we learn more and we put that in the training or course too. But we never throw anything away. We never take anything out. We just put more and more in. And so I thought content hoarding was a great way to describe that. The other thing is that people believe that creating interactive activities takes more time, and that it's time consuming. And it surely can be if you start from scratch. But this is where we're going to get to the magic wand part, because there are ways to get around that. And I think those are particularly important, again, in the healthcare environment where we often don't have a lot of time to create trainings. So we're going to practice using and doing some of the things we've been talking about, and what you've learned in the microcredential. And again, the intent is that we practice this together. We're going to do some little things together, and then ultimately you can take what we're doing here tonight and apply it in your own setting. So I wanted to keep it to a topic that would be relevant, I think, to everybody who's in healthcare. And we're going to say that the topic of our training is how to give bad news to a patient. And we're going to say that we don't know exactly who's going to be in our audience, but we do know that it's going to be interprofessional, so people from all different disciplines, and they have different levels of experience. So we're going to go back into Slido, and I want you, with this topic, the one we just said we're going to talk about, how to give bad news to a patient, type in one objective for that training. I think I've set it up so that as you're typing, or when you're done, when you press enter, your objective is going to show on the screen. So if you see that someone has put an objective very similar to yours, if you can go in and either change it or type another one, just so we don't have just one objective. We have a variety. Okay, so we have a few different ideas for objectives here. So about using appropriate language, thinking about body language, thinking about the words you're using, describing the impact, and developing a 1 or 2 sentence response for wrapping up that discussion with the patient. So what I'm going to do now is, let's see, I'm going to exit this for a second. Try that. Oh, shoot. Yes. What I want to do is be able to grab all those. And this did work when let me go back. Maybe they'll still be there. Oh, yes. Okay. Let's see if this works. Nope. How did I do this when I practiced? Shoot. All right, well, we're gonna just recreate those the best we can, because I thought I was gonna be able to copy and paste, and it's not working that way. So what I want to show you guys is Copilot, and which is an AI chat. And some of you, actually, I'm going to put you up on my screen so I can see you. If you can just raise your hand if you have used Copilot or ChatGPT before. Okay, some of you, not all of you. So Copilot is available to you as a student at Quinnipiac, and it's like ChatGPT. And it allows you to use AI. And so we're going to use that and see how that might help us with our presentation. So I'm going to open it now. So when you open that, and all you have to do is go to copilot.cloud.microsoft. It will open, it will ask you to enter in your password and all that, and it will bring you to the screen that I'm on now. And so down here, are you seeing my Copilot screen? Everyone seen that? Okay, great. You could say, I am creating objectives for a training about telling patients bad news. These are my ideas. Now, can you guys help me remember them? If someone can unmute and tell me what you said, that would be great, because the copy and paste didn't work. Or any idea. It doesn't have to be exactly what you said.
Yeah, mine was the develop a 1 to 2 sentence response to wrap up the discussion.
Okay. What else?
Something along the lines of learner will be able to describe body language when giving bad news.
Does anyone remember the other ones?
Mine was describe the impact of bad news on the patient.
And was there one more?
Mine was to review appropriate language to use when giving bad news.
Okay, so you can see I'm creating objectives for training about telling patients bad news. These are my ideas, and they're pretty vague here. You know, I just typed in what you guys said, actually even shorter than what you guys said. And now I'm going to ask Copilot. It's going to. All right, so in seconds, it has given me these objectives. Develop a concise closing statement. Learners will be able to craft 1 to 2 sentence response to effectively wrap up the discussion, ensuring clarity and empathy. Describe appropriate body language. Learners will be able to identify and demonstrate body language that conveys compassion and support during difficult conversations. Understand the impact on patients. Learners will be able to describe the emotional and psychological effects of receiving bad news on patients and recognizing the signs of distress. Use appropriate language. Learners will review and practice using language that's clear, compassionate, and avoids medical jargon when delivering bad news. So you can see how it took like our ideas and expanded on them and put them in nice, like fancy language. And as a trainer, then this actually would work. I could copy this, and it actually gives me the little copy thing here, and I could paste this. Oftentimes what you get back from Copilot isn't exactly what you want. Like maybe there's something else you want, or maybe you decide, you know, the way this is written, you can change it. But it really, you could see how quick that was. And it would have been even quicker if we didn't have to redo it to come up with objectives. So it can be a real time saver when you're creating trainings. I'm going to go back to any questions about that? All right, I'm going to go back to my slides. And so again, we could just then list the learning objectives. Good, done. And then we're going to create our other content from those learning objectives. So actually, let's just go back to that for a second. So if we knew we wanted to do this, we might develop a case study or a role play or some other kind of thing where people are able to learn what to do and then practice those skills or think about what they would do or how they would do these things. So let's move on. So that was really effective in figuring out the objectives for our presentation. But I will tell you, it's not a good idea to use AI for identifying research facts. So oftentimes, if you're doing a professional presentation, you're going to talk about the research, what's in the literature about that topic or what we know about that medical condition. But there's good reasons not to use AI for that. And so go ahead and open this Slido up and pick all that apply. All right, let's see what you guys said. Okay, so lack of critical appraisal skills. So yes, AI can maybe pull things out of the research, but what it can't do in the way that we can is look at the study and say whether it's a good study or not. Like someone might have done a study on one person and said, oh, this proves my theory. And we know, as medical professionals, that that's not really the case. We have those critical appraisal skills that AI does not when it's looking at research. AI doesn't pull the most recent research. This has gotten a little bit better. Last summer, I had heard that the most recent research was still like 5 years old. It's newer today. And AI is getting better and better all the time, but you can't count on it to pull the most recent research. There's a potential for bias and misinformation. So that has been shown throughout AI. The people working on AI are trying to correct that, but it does seem to be a problem. There is, and I will say I agree with both these next two. There is oversimplification of complex info and hallucinations, and I'll talk about that in a minute. So it does try to put things in a nice package, and you can see how it did that for our objectives. I mean, it expanded what we said, but it kind of packaged it up for us. And that works well for something that we're creating like objectives, but it doesn't always work well for the complexities of research and science. So sometimes it will tend to oversimplify things and make things seem, like this is very factual, when in fact there might be a lot more gray. And then hallucinations, this is the idea, and it's a term you hear in the AI world. And basically it is that sometimes AI will just make up stuff. So AI works by predicting what the next word in a sentence will be, which is kind of hard for me to wrap my mind around, but that's what it does. And so sometimes it says stuff that sounds really good, like it makes sense if you were to just read it, but it's not really true. And in the AI world, those are called hallucinations. And so you can't always trust all the facts that AI tells you. So AI is much better for creating things, like using it to help us create objectives, or we're going to use in a minute on creating a case, than it is for actually looking at research. So just, a caution about that. So as I was starting to say, AI can be really helpful in generating ideas. And so one of the things I had said earlier is one of the reasons people don't use interactive activities is developing things like cases and role plays. It just takes a lot of time to come up with all that stuff. And so that's where AI can be really helpful for us. So when you're creating things with AI, when you're partnering with AI to create some kind of content, you're going to use prompts. And that's what I was doing before when I was saying, I'm doing creating a training for people about giving bad news. These are my ideas. That's a prompt. And writing good prompts is called prompt engineering. And so you want to write your prompt so that AI gives you a good response. And these are 3 main points to keep in mind when you're writing your prompt. You want it to be clear and as specific as possible, especially when you're doing something like asking it to help you create a case study. So in this case, the example here is create a case scenario where a 35-year-old patient with asthma, so we have an age, we have a diagnosis, with shortness of breath, we have a symptom, include patient history, current symptoms, and initial test results for learners to analyze. So AI is going to come up with that stuff. And then you also want to provide some contextual details, because if you just ask it to do this first part, it might create something that's really complex. And perhaps your learners are, let's say, first-year nursing students. It's going to be too hard for them. So if you tell them who your learners are, that can help it create a better scenario. And then give it information about its your desired format. So do you want it to be a narrative story? Do you want it to have multiple choice questions? What do you want it to look like in the end? Now, we're going to go ahead and create a prompt like this in a minute. One thing to keep in mind is that you don't have to do all this in one prompt. The nice thing about AI is that you can make mistakes. You can ask it to do more stuff. You can ask it to change. It never gets irritated with you. It's always pleasant. And so what you might do is create the case first, like do the first part where it says clear and specific. You do that, it creates something, and then you realize, oh, this is too high level, it's too low level. And so then you provide the contextual details, and then it's all bullet points. You're like, no, that's not what I want. And then you ask it to provide a narrative story. So it's not like one and done. You can ask it to do stuff as much and as long as you want until it's what you want. And so just to get a little practice with doing that, I'm going to have you write a prompt. And again, it's using our scenario of an in-service about giving bad news to a patient. And your prompt is going to start with create a case scenario and then have it create what you want. And just go ahead and just practice writing that. Okay. So these all look great, and you all have really good information in them. So, they all, I believe, include a diagnosis and something else you want to do to make the story. So in this case, it's empathetic. In this case, it's the mutations. In this case, it's asking it to include the body language and clear wording. In this case, you've designated what kind of student it is, a nurse practitioner student. So those will all be really effective prompts. And what we're going to do next is create one together. So I'm going to open up my Copilot again, and we can use pieces of these, or we can just create one off the top of our heads. But let's see what we can come up with, and let's see what Copilot gives us. So I'm going to go back to Copilot. Okay. So create a case study, a case. Is that what it is? Create a case. As soon as I click off the slide, completely goes out of my mind. Create a case for who do we want our students to be? And just, unmute and call out anything kind of working together situation now.
Nurse practitioner student.
Okay. To teach them about giving bad news. The patient. The patient is how old?
65.
65-year-old man or woman?
Woman.
And what's the bad news we're giving? Like, what are they diagnosed with?
You can use the BRCA genes.
You have to give me that language. I'm an OT. It's not my world. Say it.
BRCA1, I guess.
Who was
wrote that?
diagnosed with, or who was genetic testing showed?
Genetic testing.
Okay. Who's genetic testing showed? Say again.
BRCA.
BRCA, like that?
One.
Okay. One.
I don't know the other ones. Two, I
That's
guess.
all right. That's fine. Jean, do we want to give any other complexity to the case? Like who she lives with or anything else?
You can add that she has like 2 daughters who may be affected by the test results.
That's great. Not that the daughters are going to be affected, but by the fact that we're including this detail. Any other details we want to include in here in our case that might make it interesting? Okay, so we can go with this. And what do we want the case to look like? Like, do we want to have multiple choice questions about it? Do we want to have it unfold in different steps of the scenario? Do we want students to interact with that case? No, no wrong answer here. Just whatever you guys want. I recently made a case that I had unfold over multiple times, and it was kind of interesting what AI did with that. So since you guys don't have a preference, I'm going to say that. Make the case unfold over time with questions for students to answer for each part of the case. All right, so we have that. All right. So this is what it's given us. So it's given our patient, oh my goodness. Okay, it gave us a lot. Person's name, they're 65. We told it that. It has put it in terms of a scenario, what's happened. So Mrs. Doe comes in for a checkup. During the consultation, she mentions a history of breast cancer. You recommend genetic testing. And then there's questions here. And then the results come back. And then there's questions for the students to answer. So you can see how this is a real time saver and can give you stuff that's really a pretty rich case in order to present to your students that you're teaching in whatever context you are. And again, you can, like I could say, add more complexity to this case. And so now it's gone on. And so the daughter just tested positive. Mrs. Doe becomes depressed. And so it's created more complexity. So it's a huge time saver. And again, sometimes you're not going to use exactly what ChatGPT, often you're not going to use exactly what ChatGPT or Copilot gives you, but it really gives you a nice starting point and allows you to create interactive activities that don't take a lot of time to create. So the other thing it can help you with is creating your presentation outline. So we've already created objectives. We have a case. We can tell it, these are our objectives. This is our case. What else do I need to include in the presentation? And it will give you ideas. Again, the more information you give it, the better it's going to spit out ideas. But even if you just give it kind of the bare minimum, it's probably going to give you something that you can work with. And then the other thing you can use it for is measuring learning. So depending on your context and the purpose of the training you're doing in your healthcare environment, you may or may not be actually assessing people's learning. But AI is really good at creating rubrics. So if you were to put in, these are the learning objectives, or this is the assignment or the activity I want the students to do, create a rubric for that. It will, just as fast as it spit out that case, it will spit out a beautiful rubric. You can give it content and ask it to create multiple choice questions for you. It can give you wording for a self-assessment, or it can give you wording for pre or post tests based on your content that you're teaching. So it can be a really nice asset in helping you provide training in a healthcare environment. And so I wanted to leave a little bit of time for questions or ideas. If any of you have used that AI, or if you have questions about the content in general, or anything about training in the healthcare environment.
This was great. Thank you. I've used AI. I had just a little bit of a side gig recently that was doing exactly what we just did. And of course, you have to double check what it comes back to you because it's not always correct. However, you can change the level of oh man, what's the word I'm thinking of? You can change the level. So like I was creating board level questions for people studying cardiology. And so I would add into the prompt, now create this as a board level, or now bring this back to high school level, information. And it would do exactly that. And you can just see the changes. It's very great.
Yeah. One of the prompts that I often hear people use is like, if you're taking something that's really complex, you could tell AI, give it all this complex information, say, explain this to me as if I was a 9-year-old, and it will just make it simpler so that your audience can understand, depending on, the complexity of the information, how simple or complex you want to make it. So that's a great point. Anyone else use AI or have any questions or comments?
Yeah, I've used it in like similar context. I'm a medical student now, so I've used it to like create practice questions for me to help study. And so I'll be taking the first step of my boards. And you can tell it like, I'm a medical student studying for my first board exam. Can you make me a question set on like cardiology, pharmacology? And it like knows exactly what level that is, and it knows like what drugs are on the test, and like basically like can make an exact question. So it's been really, really helpful. But it was really interesting tonight to see how you can use it from the teaching perspective, because I've only used it as a learner so far. So thank you.
You're welcome. Anyone else?
I use AI frequently to make my reference lists for papers. I do need to edit after, but I find it very helpful for that. And in terms of, I work in mental health, and I feel like it's been helpful in like crafting more professional verbiage around like designing websites for my practice, and like clinician bios. And so, because in part of my education is like helping other people who want to start their own practices, start their own business. And so use like incorporating AI into education around how to start a business is an area that I think is really interesting.
Yeah, yeah. I think it is the way of the future, and because we can spend less time doing some of this stuff, we can spend more time actually on making it better and moving beyond kind of the elementary things. So I think it opens up all kinds of things. And again, it really makes it easy to embed interactive activities in your training so that hopefully none of us will be, just a talking head reading off the slides. So I thank you guys for your time and attention tonight, and I wish you all the best in your educational journeys.
Thank you.
Thank you.
Thank you.
Thank you so much, Barbara. Thank you everyone for being here.
Bye.